We stick with people through their struggles regardless of what they are. I think that's when you see change. And so I think that's a lead advantage.
So LEAD is Law Enforcement Assisted Diversion, which is based off of a program in Seattle, and is designed to work with individuals who have low-level, non-violent related offenses that are related to substance use or subsistence living, and offering them an alternative to arrest and being booked into the county jail.
What was really interesting to me, even in the early stages, that we're already seeing a reduction in drug-related crimes and other crimes in the pilot area.
They have done their program for quite a while and have been really successful in reducing individuals' recidivism from going to the county jail.
So this was a state grant that was awarded to us. It was a competitive process that we applied for, and the department is the main administrator of the grant, but it requires that we work with multiple agencies around this. So we have a committee that it includes both the DA's office,
Bay Area Rapid Transit Police Department, and San Francisco Sheriff's Department as our law enforcement agencies, the Public Defender's Office,
adult probation, so a number of different agencies that are working together to really look at the population that ends up in criminal justice because of substance use and how we can change our models of care so that they don't necessarily end up in jail.
I think that having partners in the health department, having partners in the nonprofit world, as well as the public defender, are critical to the success. And I believe that we are beginning to succeed because we have that collaboration.
So agencies that used to be disparate and not connected at all, or very little connections, are brought together at the same table.
The collaboration is a good thing for us. It's a good thing for our city, it's a good thing for our department. The collaborative effort gets us all working in the same direction, and I think that's really important because these are some complex issues we're dealing with.
When you have systems that are as complicated as policing and health departments and probation and jails and nonprofits, it requires people to come with a common mission and a common vision to work together, and so everybody has to put their egos at the door. And we have done so in San Francisco, and I believe we've done it very, very well.
And so turning the model of care where police, district attorney, public defenders, our community-based organizations, and us were all involved to work towards a common goal. Nobody wants to see drug users be put into jail. They want them to get the correct treatment that they need. I think that was really special about LEAD, bringing all those partners together.
We're piloting LEAD in a couple of areas in San Francisco, actually close to here, close to Civic Center, along Market Street, UN Plaza area, Powell Street, where the BART station is there, and over in the Mission, 16th and Mission, where that BART station is.
Certainly our goal in San Francisco, as well as was the goal in Seattle, is to work with individuals who otherwise are cycling in and out of the criminal justice system and are falling through the cracks. And using this as an intervention to address that population and also the racial disparity that we see in our criminal justice system, which is why we also wanted to focus on the Mission and Tenderloin districts.
A lot of the money is going towards direct contact with the individuals. Our partners at Glide and Felton have hired engagement specialists as well as case managers that deal directly with the clients. So case managers that get referrals from the police or from other city agencies will then connect with the person really to determine what their needs are and how we can best meet those needs.
I had nobody, no friends, no resources, didn't know how to get plugged in with shelters, nothing, flat out. Just on my own. Witnessed a lot of horrible stuff. Women getting beat, men getting beat, a lot of transgenders getting, beat up and stuff. I saw people get shot, saw people get stabbed.
These are people who perhaps have had many visits to the county jail here in San Francisco or to other institutions. And we're trying to connect them with the resources they need in the community to break out of that cycle.
And so all of the referrals for the program are coming from a law enforcement agency.
How that works is officers observe an offense. Let's say you're using. It's found out that you are in possession of drugs. That constitutes a LEAD eligible offense.
So an officer would talk to the individual about this program, about participating in the program instead of being booked into the county jail.
Have you ever heard of the LEADS program? Yes. Are you part of the LEADS program? Do you have a caseworker?
I Yes, I do have a case manager.
When they have a contact with a possible lead referral, they give us a call, and ideally we can meet them at the scene where the ticket is being issued.
They're nonviolent people. These are primarily what you're talking about is you're talking people that are under the influence of drugs, but they will all be nonviolent. If they were violent, then they wouldn't qualify for the LEAD program.
You know, you are thinking that maybe I'm going to get arrested, or maybe, you know, I'm going to go to jail for something that I just did because of the substance abuse issues I'm dealing with.
Then they would contact one of our outreach workers to meet the individual.
But then all of a sudden Glide shows up, or Felton shows up, and we're saying, look, you know, you're not going to jail. You know, we can take you, and you know, what is it that you need? You know, let's meet you where you are, and you know, without telling you exactly what that's going to look like, you know, let us help you, and help you help yourself.
And then bring them to the Community Assessment and Services Center, which is run by the Adult Probation Department, to have an assessment with the Department of Public Health staff, again, to assess their mental health and substance use disorder treatment needs.
But it also provides meals, you can go to groups. There's a lot of other things happening there that make it a welcoming open space that clients can access. But once they're there, they go through a very detailed assessment about what their needs are and potentially how we can meet those needs.
Someone who otherwise would have entered the jail system, or otherwise would have been arrested and booked on a charge, is actually diverted to social services, to Glide if they're in the Tenderloin, and to Felton if they're in the Mission. And then from there, you know, instead of them going through that system, which, you know, hasn't really shown itself to be an effective way to deal with people who are suffering from substance abuse issues, they can get connected with case management, which can, you know, offer them an array of different services really based on their need as an individual. One of the key things for us is that our approach is client-centered. And so harm reduction is very much based around, you know, helping the client and meeting them where they're at, in terms of, you know, what steps are you ready to take?
We're not asking individuals to do anything specific at any point in time, and it's a program based on whatever it takes and wherever it takes. So we're going to them and working with them where they feel most comfortable in the community.
If you can bring things directly to people, it opens up doors, and they get access they wouldn't have had otherwise.
And again, supporting them on what their goals are, that we're not assigning goals to them, but working with them to come up with an individualized plan of what recovery looks like to them and what success looks like to them.
Because I've been in the field a while, I can offer a bouquet of possibilities, you know, that offers different choices, and then let them decide which one that they want to go down and help them along that path.
It's all on you. We're just here to help you, guide you. We're not trying to force you to do what you want to do or change your mind and tell you what to do, whatever. It's you telling us how you want us to help you.
And I think it means a lot to our clients to know they have someone in their corner who can be creative in the way we can assist them.
They always pick up their phone. That was one of the things that was like such a blessing for me to have them when I was out there on the streets, was no matter what situation, no matter what payphone, cell phone, somebody else's phone, by calling them, they always answered.
The traditional models of care where you come into an office-based setting, you have somebody that's at the reception desk, then you go see the clinician, isn't something that really will work for this population of drug users that are on the street. And so that has really been helpful to change this model of care and see the outcomes.
We will pick you up and we will take you to the appointment, and we'll bring you back, and we'll get you some food on the way. And we'll make sure that your needs for that night are taken care of, so you won't be out in the cold.
Their first recommendation to like try to push me to feel like I have their strength behind me, to not be afraid, you know, to ask for help with the lead team.
Can we get you to a place where you're using less and less and less so that you can then function and have a normal life, a job, a place to stay, be a functioning part of the community? Those steps along the way are all part of the harm reduction model. It might not be that you're completely off the substance, but that you're using less, and then that way you're allowed to be kind of a viable member of society. So I think this is really an important question of where LEAD will go from here, and I think part of it is looking at the data that we've collected so far and seeing where we've had successes, and we can build on those successes, and then as a department, based on that, where the investments need to go.
We've been working for like 5 months, and they're still pushing me to motivate me, and I'm still clean, you know?
And hopefully as the final report, we'll come up with kind of a model that may help with all the communities within California.
I want to go back to school, but start my GED And once I start my GED, I want to go to community college.
I think it can be something that can be scaled out, and that's the hope anyway.
There's a huge need in other parts of the city, so depending on that need and depending on the data that we're getting, we definitely can see an expansion.
You know, we're all hoping, obviously, you know, the program is successful and that we can actually implement it citywide. I think it will save our county millions and millions of dollars in emergency services, police services, prosecuting services. But frankly, more importantly, at the end of the day, I think it will save lives.